There's a statistic that says nearly 1 in 4 adults age 65 and older are socially isolated. Yes. So again, we try to tell people, it may not be the best thing to keep them at home because of the studies, just the effects of loneliness and social isolation on people's health. Statistically, there are numbers, put to it, studies that have shown that there are effects on, there's a higher risk of health problems such as heart disease, actually 29% greater chance of heart disease due to loneliness and social isolation. I don't know, it's depression and even cognitive decline. The chances of dementia are increased by 50%. Again, because you're not interacting, you're not
Right.
using your brain like you would when you have a conversation or doing an activity. Adults who are lonely and socially isolated are less healthy, have longer hospital stays. They're usually admitted to the hospital more often, likely to die earlier, and really they're lacking meaningful and supportive relationships. So besides the dementia, heart disease, and stroke, there's also studies about type 2 diabetes, because maybe they're not getting the correct diet, depression, anxiety, and I think that happened a lot over COVID, especially when people were isolated even more. Addiction, and just earlier death. And then there's there's a statistic that says nearly 1 in 4 adults age 65 and older are socially isolated. So it's really important to be, either if they're not in a community, maybe they're still, vibrant and they're living at home, then go join a senior group. Go, pick up a hobby. Make sure you communicate. Drop your friends a letter. Call them on the phone. Set up a coffee date if you can. Even now with technology, you can Zoom. You can, spend some time speaking to family and friends. We used to, a group of friends and I, we would do like a happy hour. So we'd all get on our Zoom or with our families and make it kind of fun. I mean, the study that I had was back from 2020, but it said loneliness costs the U.S. economy an estimated $406 billion a year, in addition to the estimated $6.7 billion a year in Medicare costs for socially isolated older adults. So it's an epidemic.